Hi, my name is Mandy Weaver and I'm a nurse practitioner here at Southeastern Orthopedics with Dr. Kevin Speer. You're watching this video today because you are getting ready to have a total shoulder replacement. So today we'll kind of go through that surgery process and answer some of your questions and concerns hopefully. So in order to prepare for the surgery, the night prior to your surgery, we don't want you to eat anything after 10 p.m. the night before. You can have water or clear liquids up until 3 hours before your surgery, and we'll go over with you individually which medications are okay to take with water that morning. Now, we want you to take a shower that morning, wash as you normally would. Then we're going to give you this scrub brush. We want you to scrub from the base of the neck all the way down the front of the arm, back of the arm, underneath the armpit, and then you're going to rinse this soap off. This has soap in it. It's activated when you scrub with the water. Scrub down that arm for about 5 minutes, and then you're going to rinse all that soap off just like you normally would. And when you get out of the shower, dry off really well, and then no deodorant under that arm, no lotion, no cream, nothing on that arm. Just keep it nice and clean. Best thing to wear either to the hospital that day or definitely home from the hospital is a button-up shirt or just a loose oversized shirt is what you want to have with you. You will stay one night overnight in the hospital. So make sure you wear something, loose and comfortable to go home with, because you're going to have the sling on here, and then the shirt is going to just go drape over that shoulder there. So just something loose, like button up, just to get uncomfortable for you. Now, in order to prepare for your surgery, anesthesia will first give you what we call a nerve block, and that's a numbing medication that they'll give you, and that will help with pain after the surgery. So that'll have your arm numb for about 2 to 3 days after the surgery. It'll be completely numb for about 12 to 24 hours. After that time period, you might feel it kind of waking up a little bit, but you won't have the full sensation back from 2 to 3 days. It can wear off at different times for different people, so whenever that block wears off and you start getting feeling and it's hurting you, you can go ahead and take oral pain medication, which we'll give to you. So we'll prescribe that pain medicine for you. That'll depend on your medical history, and you will have that medication prescribed to you before your surgery. So you can go ahead and pick that up and have that ready for you at home. Now, you'll have the block, and then you'll go in the operating room and they'll give you IV medicine to put you to sleep. There's no tube down your throat. It's not general anesthesia. You will be breathing on your own the whole time. Your incision is going to kind of go down the front of your arm here, and you will have staples and stitches in that incision. The dressing that goes over that is waterproof, so you're just going to leave that dressing on. You're going to shower with it on. Keep that dressing on until you come back here to see us. That'll be about 2 weeks after your surgery. You'll have a sling on, like we mentioned. The sling is just a simple sling. There's no pads or attachment to it, and that's just to keep that sling just kind of at a 90-degree angle right here, kind of like right across your stomach here. Okay, and then you'll have an ice machine. You go home with that. That's called a polar care unit. It's a cooler. It's about this size. Has a tube that connects to some straps that go all around the shoulder. We'll put that on you right after the surgery. You're just going to keep that attached the first 3 days after surgery. You'll like the ice because the ice numbs the shoulder, so that's going to help with pain. It also helps with the swelling on the shoulder. All you do to that cooler is fill it up with water to a certain line you'll see inside of it and put ice in it. What you can do instead of ice is frozen water bottles. So if you want to go ahead and freeze 16-ounce size water bottles, you can place those inside that cooler. And that way that cold will last a little longer instead of you having to replenish that ice so often. So keep that on the first 3 days after your surgery. And then the 3rd day, as long as you can feel that arm again, that sensation is back, and you have enough strength to raise your hand to your mouth, just this motion right here. As long as you're aware of your arm and you're able to do that, Then it's okay to take the arm out of the sling, and you can straighten your arm out at your side. That's okay to do. Go ahead and take the ice off, leave the dressing on. Remember, the dressing's waterproof. Straighten your arm out at your side. What you don't want to do is reach here. You don't want to reach up here. You don't want to reach behind your back. No lifting, pushing, pulling. Just have your arm straight at your side. A lot of times people ask how to wash underneath your arm. So in order to do that, you're just going to kind of bend forward a little bit. So if you're standing, you want to just bend forward, and then you can safely wash underneath your arm without raising that arm up, because we don't want you doing that motion just yet. So that's okay when you're in the shower, and then when you get out of the shower, go ahead and put that sling right back on. At that point, you can go ahead and get dressed, like put your shirt on and put the sling on the outside. But remember, when you leave the hospital, we discussed, you'll have the sling here, shirt will go over that arm, okay? So when you're putting your shirt on, just remember you're putting your shirt on down here. Don't, you're not doing this number to put your shirt on, but at your side. And then once you get that shirt on, put the sling right back on. You'll wear the sling for 3 weeks, day and night, as well as when you're sleeping. And then after 3 weeks, you can come out of that sling, and we'll show you a few exercises you can do at your follow-up appointment. And then in 4 weeks, that's when you'll start your physical therapy. That'll be 3 times a week for about 12 weeks. And we'll talk with you about therapy, because we'll get a location that's close to your home, that's convenient. So we can provide a list of that for you, a list of different places, but then we will have you set up that therapy appointment. The prescription for that therapy you will get at your follow-up appointment, which we'll see you back in 2 weeks, and then you just take it to your appointment with you in 4 weeks when you start that therapy. Now, when you come out of the sling, a few things to keep in mind: no lifting heavier than 1 pound or a can of Coke, we say for reference, for really about the first 3 months after your surgery. Another thing we don't want you to do is to reach behind your back, okay? So for ladies, you're not clasping a bra back there. You're not putting on a belt, behind on your pants. Best thing is to put the belt on your pants first, and then put your pants on. The other thing we don't want you to do is to push up with that arm, like to stand up. Fine to do it on the other side if you need to, but we don't want you pressing up and putting all that weight on that shoulder, and that's for the first 3 months as well. So just 3 things to keep in mind. That and all this information is written down as well, so you can look up, view this information via my chart or printed if you come into the office. So keep those things in mind. Sleep can always be hard after surgery, so if you have a recliner, that's the best place to sleep, at least the first week after surgery, if not longer, just to make you a little bit more comfortable after your surgery. If not, wedge pillows work well, or a firm sofa pillow, just something to prop your shoulder up, and that'll help the inflammation for that shoulder being above the level of your heart. Now, you might notice some swelling in that arm, like down the arm or in the hand, because you're in that sling position, the first 3 weeks. So if you notice that, what you can do is do gripping exercises. Then a lot of times they'll give you a little foam ball over in the hospital, foam wedge, and you can use that and kind of do some gripping exercises, kind of get that circulation moving. You can use anything, a stress ball, rolled up washcloth, just anything that you can kind of place in your hand while you're just sitting there that you can kind of keep gripping on to get that circulation moving. That is fine to do. Now, medications we talked a little bit about before, but we will prescribe an opioid pain medicine, which that'll be individual specific for you. Make sure you do have a stool softener, because those pain medicines can constipate you. So Miralax or Synacot or Dulcolax, there's several different kinds. That information is written down as well, but that's important to get. Make sure you drink plenty of water after surgery, because you will be dehydrated a little, so more fluids the better, water being the best. Another medication will give you some for nausea, just in case you should need it. You can do the anesthesia or the pain medications. We'll let you know about that. And then the last thing is an anti-inflammatory medicine. Something like ibuprofen, Aleve, just something to kind of get a hold of that inflammation and to help with your healing. So we'll discuss those specific medications that are prescribed during our individual discussion. And then all this material will be written down so you can always look back. There's information about the Polar Care video with instructions on that. The block, there's more information about that if you want to know more about that. More specific instructions are written down for you to review as well. It is important too to walk around as much as you can after surgery. When you're in the hospital overnight, occupational therapy will be working with you a little bit before you go home, but it is important to move around, as much as you can at home. That's totally fine. You don't have to just sit in the chair. We want you moving, pumping those legs, because that helps that blood to circulate and decreases any risk for blood clots after your surgery. So move around as much as you can. That's fine. Make sure you are on a steady surface. Make sure you're with someone. Don't try to walk, if you normally walk 2 or 3 miles a day, you're not going to be ready for that right after surgery. Don't do that alone. Make sure somebody is always with you if you go for any walk anywhere. But don't walk any big significant distance. I wouldn't at first week or so. So these are all some things to kind of keep in mind and help you prepare for your surgery. If you have any additional questions or any concerns or anything more unique to your situation comes up, please don't hesitate to give us a call. This is just meant to be a video of reference that you can kind of look back on if you have any questions or anything. So if you think of anything different or we can be of help in any way, please let us know. We want to try to make this process as smooth as possible for you, and we're always here for you. So please reach out with questions. Okay, take care. Hope everything goes well with your surgery.